Thank you, Mr. Speaker. I wasn't here on Friday due to taking our oldest daughter for a medical procedure, but I was able to watch and listen to the work on the floor that day. I wanted to add a few comments to the conversation regarding House Bill 354. I'm going to cast a yes vote on my record because I believe the gentleman from Bullitt worked hard on this over many years to put in place proper guardrails, and I believe overall it is a very good bill. However, I would concur with the lady from Kenton 64's suggestion to add back the requirement that an APRN must have been licensed to practice for 1 year with the Kentucky Board of Nursing prior to getting prescriptive privileges of controlled substances. Physicians who are under supervision in their first year of residency cannot prescribe controlled substances for a year. With the vast difference in the level of education, physicians have 4 years postgraduate education, 3 to 7 years residency, 12,000 to 16,000 hours of patient care required throughout their training, versus APRNs who have 2 to 4 years of postgraduate education, no residency, only 500 to 720 hours of patient care throughout the training. I believe waiting a year is not too much to ask for both the protection of the APRN and their patients. Lady from Jefferson 34, yes, APRNs pay a fee for a collaborative agreement, and some physicians may gouge them. But why do they have a fee? It's because they assume liability for them. If an incident happens, the buck stops with a collaborating physician. Gentleman from Jefferson 36, yes, the physicians, along with APRNs and anyone else with prescriptive privileges, have contributed to the opioid crisis. When I asked the question, how did this happen, I was told that when the federal government made pain the fifth vital sign, those with prescriptive privileges were looked at as villains or having no compassion if they didn't write pain meds. I've said it before on this floor, I'm not a fan of Big Pharma, but I believe they have had a huge effect on all of this to benefit their bottom line. I believe re-education of current prescribers and current education needs to be strong on how to responsibly prescribe so as not to create addiction and potentially consider alternatives. The issue of a shortage of physicians was discussed. I believe we have a shortage of physicians in Kentucky for various reasons, one of which may be we may need more slots in our medical schools. Electronic medical records slow down providers. Some new physicians in our area only see 6 to 8 patients a day, and when I asked, are they that lazy? The answer given was the EMR slows them down that much. And with many physicians being hired, they are not incentivized to see more patients, and I believe it can create a 9-to-5 mentality. However, gentlemen from Nelson, I would also contend that we need additional tort reforms because I know many good physicians have left Kentucky due to the high rate of medical malpractice suits, not necessarily because anything was done wrong, just that there wasn't a perfect outcome. I would caution this body on any issue, whether it be shaping the practice of ARPNs in Kentucky or anything else. Remain objective about facts and think about all of your constituents, not just the ones who are blowing up your email, blasting you on Facebook, or whatever. Consult experts you trust on whatever the issue is who are objective and not biased for the facts. Base your votes on facts and have the courage to take a vote that might take you home for the good of all. Thank you, Mr. Speaker.